Okay. So welcome to everybody who's here in person and who's going to watch this later. We're here for Amanda's thesis defense, and we have Vern Miller here as one of the readers. Unfortunately, Katie Leckenby cannot be here due to some health problems. So we will send her this recording to see. So take it away, Amanda.
All right. All right, is that coming across for everybody? Good. Let me just get this bar out of my way and all right. So my thesis is on neurologic music therapists' perspectives of neurologic music therapy and disability, areas of strength and areas for potential growth. A review of what neurologic music therapy is that it is the therapeutic application of music to cognitive, affective, sensory, language, and motor dysfunctions due to neurologic disease of the human nervous system. It is a standardized system of clinical techniques that use the functional perception of all properties of music to train and retrain brain and behavior function. So that is the definition that is taken from the Neurologic Music Therapy Academy of Neurologic Music Therapy. It is a set of 20 standardized evidence-based music therapy techniques. So these 20 standardized techniques are used to address a variety of non-musical goals. So essentially you're using music to address something that is non-musical. It is based on research regarding music perception, cognition, and production. And it was established in the 1990s based off of early research on the ability of auditory rhythmic patterns to entrain movement patterns in patients with movement disorders. So it kind of began there in the area of movement disorders. So some research that kind of got me interested in this thesis topic specifically is that I noticed that in a lot of neurologic music therapy literature, they express that music is most effective as a stimulus influencing neurophysiology and kind of really addressing those areas of physical rehabilitation, cognition, sensory motor functions, rather than as a carrier of sociocultural values in the therapeutic process and those more abstract concepts that a lot of music therapists work with. I also found through a review of literature that there is a lot of benefit in valuing a more holistic biopsychosocial, cultural, spiritual approach to treatment. I have a quote here from George Egan's. It says, to understand and respond adequately to patient suffering and to give them a sense of being understood, clinicians must attend simultaneously to the biological, psychological, and social dimensions of illness. So that kind of got me, thinking about how neurologic music therapy exists within that kind of holistic approach. And I was interested in how other neurologic music therapists might perceive that as well, especially in terms of, what NMT does well and what it could improve on in that area. So that kind of gets me into why this topic. So originally, my interest in music and the brain led me to pursue NMT certification. When I took the NMT training course, certain things didn't sit well with me. I noticed that there was kind of that sense of superiority regarding NMT being the music therapy and the only thing that is going to help patients improve. I noticed that there was some ableism in the training, in my perspective, a reliance on medical models, and sort of that centering of, the neurological, physical dimensions, maybe at the expense of some of the other domains. So again, I was kind of wondering whether other NMTs might feel similarly or may have noticed the same things when they took the training, or when they have read NMT literature. And I also noticed that limited literature exists providing a critical analysis of NMT. So there's a lot of literature out there talking about what neurologic music therapy is, how it is effective. There's a lot of research regarding how the various NMT techniques are effective in addressing specific goals, but not too much providing a critical analysis. So that led me to develop some research questions. I had 5 research questions that I was looking at as part of this thesis. One of them was, what do practicing or recently practicing neurologic music therapists see as the strengths and weaknesses of neurologic music therapy as a model of music therapy? The next question was, in what ways do practicing or recently practicing music therapists think neurologic music therapy centers disabled clients? And in what ways do they think neurologic music therapy utilizes a deficit lens of disability? How do neurologic music therapists currently approach goal setting and treatment planning with clients? How do neurologic music therapists view the role of the therapist and the role of the client? And the last question was, from the perspective of practicing or recently practicing neurologic music therapists, how can the Academy of Neurologic Music Therapy improve its training to become more disability-centered? So in terms of the participants in this study, the requirements for participation were that they are a current NMT fellow or affiliate, or that they have been an NMT fellow or affiliate within the last 5 years. 5 people participated in this study, and just kind of a look at the background of some of the participants, because I did ask about their theoretical orientations to music therapy as part of the research questions. And none of them really considered themselves to be strictly neurologic music therapy practitioners. 3 of them described themselves as being eclectic, and some of the words that they used to describe that eclectic approach were collectivist, person-centered, anti-oppressive, behavioral, humanistic. One participant described herself as being primarily humanistic, with more of a focus on those social, emotional, spiritual domains that I kind of mentioned previously. And one participant considered herself to be more outcome-oriented. She kind of described that idea of using music to work towards non-musical goals. This is a qualitative research study, and I utilized semi-structured interviews in which I had six questions, which I asked the participants in their interview, and then they were able to elaborate on their response as much or as little as they wanted to or were comfortable with. I conducted the interviews via Zoom. And these were the discussion prompts that I asked to kind of gauge the participation. And these prompts were, how would you describe your theoretical orientation to music therapy, and how do you find that this impacts your practice as a neurologic music therapist? What do you find to be areas of strength for neurologic music therapy as a model of music therapy? What do you find to be areas of potential improvement for neurologic music therapy as a model of music therapy? In what ways do you think neurologic music therapy techniques are helpful to clients? In what ways do you think neurologic music therapy techniques may cause harm to clients? And in your opinion, how does neurologic music therapy approach disability? In what ways is its approach beneficial, and in what ways is its approach harmful? After I conducted the interviews on Zoom, I recorded each interview. So I listened to the recording, transcribed it. Following the transcription, I sent the interviews back to the participants, typed out so that they could check the accuracy and make sure that their opinions were accurately being reflected, just to make sure, I got down what they wanted me to get down. And once those were checked by the participants and everything was good, I coded for themes in the transcription. So I looked through the themes. I utilized inductive coding. So I did not go in with an idea of what themes I was going to be looking for. The themes kind of came out at me from the interviews. I extracted the codes from the participants' own words. The codes were the themes within the interviews. And then I condensed those ideas into a single idea. So those themes that came out through the coding, I kind of categorized them in two areas. So there were three themes that came about as strengths of neurologic music therapy. So those three themes were supported by empirical evidence, client and caregiver agency, and that theme also included two sub-themes that stood out, which were empowerment and motivation, and that NMT is helpful in addressing specific goals. And I'm going to be going over all of those in a little bit more detail. And then there were three themes that stood out as areas for potential improvement for neurologic music therapy. So one of those themes that stuck out in terms of improvement were that some of the participants had issues with the Academy of Neurologic Music Therapy and the NMT training program. The sub-themes that stood out within that theme were that they noticed ableism in the training. They thought there could be some potential modifications to the training. They noticed that NMT often positions itself above other models of music therapy. They noticed ableism in practice as a theme, and that NMT often includes narrow goal areas. So to kind of break down those themes in a little bit more detail, I included some direct quotes from the participants, and there's a lot of words on the screen, so you can kind of read through it while I talk about kind of how those quotes all kind of fit together. So one of the strengths of NMT that the participants noticed was that it is supported by empirical evidence. And this theme kind of came up throughout all 5 of the interviews. So participants noticed that there is a lot of really concrete research regarding neurologic music therapy. A lot of studies have been done, a lot of peer-reviewed articles in different journals. And these NMT techniques that have been studied and written about are used by professionals outside of music therapy as well. So they're used by speech language pathologists, physical therapists. So these are all things that have been really strongly researched, have a lot of concrete support, a lot of concrete data supporting the use of these neurologic music therapy techniques. It takes what we know about neurology and how we can utilize music to create neural pathways that contribute to healing. Due to that concrete research and the concrete language that we have to discuss neurologic music therapy, many of the participants found that it is easier to explain NMT to non-music therapists using that language that they are going to understand. A lot of like the medical language that is easier to convey to people who may not know a lot about music therapy. One of the participants talked about how she's worked with patients who may be hesitant at first or might not understand how music therapy can help them. And she finds that it's helpful to be able to have that, that research, that backing in research, to be able to show her clients and say, this is what we're going to be doing. This is how it helps. And she says that that has helped clients feel more comfortable with receiving music therapy services or being more open to music therapy as a treatment plan. So the next theme that came out as a strength of neurologic music therapy was that it may provide caregiver and client agency. So the two sub-themes within that theme that came out through the interviews were empowerment and motivation. So participants talked about how a lot of times, especially in hospital environments or rehabilitation environments, parents or caregivers feel displaced from their role as a caregiver. And we are able to teach neurologic music therapy techniques to the parent or to the caregiver, and then they can utilize that technique with their child or their dependent. And that kind of gives them a sense of, it returns their agency as a caregiver when they might be feeling displaced from that role. It also may help clients feel empowered to participate in their own treatment. When we're able to say, this is the technique that we're doing, this is how it helps, and then you can teach them specifically how to do that technique on their own, and then they can, practice it on their own and contribute in that way to working towards their own recovery. Participants also found that being able to participate in this way may increase feelings of motivation for clients or caregivers to be a part of their treatment process. It might provide motivation to, keep going when they're able to see concretely how what they're doing is helping them work towards their goals. So due to that concrete research that we have regarding neurologic music therapy, we know that it is really good at doing certain things. So we know that, this technique will help with this, or this technique will help with this other thing. And we know that through the research that we have. So participants talked about how neurologic music therapy works towards speech really well. It works on cognitive skills, physical rehabilitation. One participant talked about melodic intonation therapy, in particular, as a technique that she utilizes often. And she claims that she sees really fast and really clear results from utilizing this technique. She says, "It is pretty amazing to see how somebody can go from singing to speaking a sentence very quickly." Another participant talked about how sometimes she will use NMT techniques and adapt them to work on things that may not be what they were originally intended for, but she finds that they're also helpful to address things like self-regulation. She talks about working with an autistic student who might be feeling really dysregulated. And so she uses something like RAS, which is rhythmic auditory stimulation, to bring them, center them more in their bodies and kind of become more regulated, and then be able to do the rest of the things that they want to do. So as far as areas for improvement, one of the themes that stood out in many of the interviews was that participants had issues either with the Academy of Neurologic Music Therapy itself or with their experience in the NMT training. So one of the sub-themes that came up while looking at that theme specifically was that people noticed a lot of ableism within the training, some ableist language, kind of talking about the client as someone who needs to be changed or fixed, and fundamentally changing who that person is. They noticed an attitude of, of course, this is what the client is going to want. And then just, making that assumption that that is what the client wants to work towards, maybe without that input from the client. Another issue that some of the participants had with the neurologic music therapy training was that they felt it could be longer. One participant talked about how she was able to sit on her couch for 3 days and get a certification that's nationally accredited. And while that was accessible for her, she felt as though maybe that wasn't enough to have this particular specialization. Participants also noticed that the training felt a little bit more credibility focused rather than client focused. So they felt as though sometimes the way it was presented was that it was all about, this is why neurologic music therapy is so great. This is what makes it credible. This is, and presenting it as more, this is why neurologic music therapy helps us as therapists versus the clients themselves. And they also, with kind of related to that, noticed that it might have been beneficial to talk about goal setting a little bit more and talk about, why are we setting the goals that we are setting? Is it because it's something that the client wants to work on? Is it something that is going to benefit the client really? Or is it more so, we're trying to prove something to ourselves or to other professionals? Another issue that some of the participants had with the NMT training and with neurologic music therapy literature is that some of the techniques that are used in neurologic music therapy are actually things that other music therapists who don't have the certification also do all the time. Like one participant discussed therapeutic singing, which is a neurologic music therapy technique, and said that really you're just singing with a client. And she says, why are we pretending it's different when we call it that, or that it's different from an NMT perspective, when it's really just singing with a client to reach a variety of goals? Another participant also talked about therapeutic singing and rhythmic speech cueing, which she says is really just a fancy way of saying lyric fill-in. So it's things that are utilized by other music therapists, but have been kind of rebranded as specific neurologic music therapy techniques. Finally, participants also took issue with the fact that they felt that neurologic music therapy and NMT leadership often positions itself above other models of music therapy. And kind of, undermine other ways that music therapists practice. They talked about a sense of elitism and it being presented in the way of saying, this is the only way to do music therapy. All other methods are inferior. No one else does research, which the participants found not to be true, just in their own clinical experience and their own, training in music therapy. There we go. The second theme that came up as an area for improvement was ableism in practice. So I talked a little bit about how the participants noticed ableism in the training, but they also talked about ways that ableism may be prevalent in neurologic music therapy practice. So some of that has to do with the goals of NMT, which we kind of talked about how that was presented in the training, but also how it could pertain to the way neurologic music therapists leave that training and then practice NMT in their own clinical work. So participants talked about how the goals of NMT are often concerned with getting people to communicate or behave in the way the rest of the world sees as normal. And this may not actually benefit the client, but may rather just make things easier for their caregivers or their teachers. So it's kind of about looking at what would be best for the client rather than, just trying to change them to fit in with the rest of society when that may not actually be what is good for them. one of the participants talked about how neurologic music therapy is a framework that could make it easier to see your client as less than and as a person that you are trying to fix and change to make them more like yourself or make them more, neurotypical or non-disabled. And how that could, bleed into a person's practice of neurologic music therapy, due to the way that, the training happens. I also noticed some narrow goal areas in neurologic music therapy. So this is kind of going back to that holistic approach. And participants noticed that while NMT does address specific things very well and very accurately, it may not be addressing the whole person. So you may be working on, gait training or recovering speech after a stroke. But if you're narrowly focusing on just that one area, you could be missing other things that are going on for that patient at the time. You could be missing, some emotional things that are going on for them, spiritual things, how they're doing socially. And so when you are using this very formulaic approach, participants were concerned that you may just be, narrowly focused on this formula and doing the techniques as they are prescribed and not really seeing the client as an individual. Some of the participants talked about how neurologic music therapy may not be applicable to every client. So it may be too structured for some people, or it may just not resonate with a client, whereas another approach to music therapy may be better or maybe something that's more motivating for a client. One participant, a quote from her was that just because NMT techniques are proven scientifically to work to address certain things, that doesn't mean those are the only things that work. And sometimes a client might respond better to a different way of doing things. So after taking a look at those themes and sub-themes, bringing it back to those initial research questions that I had, one of those questions was, what do practicing or recently practicing neurologic music therapists see as the strengths and weaknesses of neurologic music therapy as a model of music therapy? So those were all of those themes and sub-themes that we just went over. I'll leave it up just for a second so you can take a look at it, refresh your memory. The second research question that I wanted to delve into was, in what ways do practicing or recently practicing music therapists think neurologic music therapy centers disabled clients? And in what ways do they think neurologic music therapy utilizes a deficit lens of disability? So, in looking at those themes that arose in the research, I noticed that participants felt as though, it provides those feelings of agency for clients and caregivers. It provides a sense of empowerment and motivation. And one of the strengths of neurologic music therapy in the perspective of the participants is that because you can teach the neurologic music therapy techniques to clients and caregivers, it can restore a sense of agency, reduce feelings of caregiver displacement, empower and motivate clients to participate in their treatment. And as far as how neurologic music therapy may utilize a deficit lens of disability, participants seem to find that neurologic music therapy can position the therapist as the expert and the client as someone in need of being fixed or someone in need of being changed fundamentally. And when therapists approach the client with this mindset, they may run the risk of developing goals without input from the clients. So the therapist may go into an assessment thinking, I'm the expert. Because the client has such and such diagnosis, this is the therapeutic technique that we're going to use to work towards this specific goal that I have in mind, and not really taking into consideration what the client may need, what accommodations the client may need, or, what goal the client may want to work on for themselves. The third research question was, how do neurologic music therapists currently approach goal setting and treatment planning with clients? So kind of expanding on that idea of the therapist positioning themselves in an expert role and the client as someone in need of being fixed. As it is currently taught, many neurologic music therapists set goals and develop treatment plans without input from clients. They may be setting goals to benefit other people other than the client, such as parents or teachers, just to, maybe extinguish a behavior from a client that is troubling to someone else without really looking into the root of that behavior or what the client is trying to express by that behavior. And participants also noticed that some NMTs may set goals which uphold ableist systems. Next question was, how do neurologic music therapists view the role of the therapist and the role of the client? So again, that was kind of that therapist as the expert, client as someone in need of being fixed or fundamentally changed. This was something that was really prevalent in the interviews, something that kind of came up in multiple areas. And then the fifth, and I believe the final research question, that it was from the perspective of practicing or recently practicing neurologic music therapists. How can the Academy of Neurologic Music Therapy improve its training to become more disability-centered? So when considering all of those strengths and areas for potential improvement, those things that the participants noticed within the NMT training, things that they thought could be done, maybe differently, were increasing an emphasis on relationship building with the client. Participants noticed that this was not something that was necessarily discussed in the NMT training or in NMT literature. And perhaps focusing more on building that therapeutic relationship and that rapport with a client could lead to therapists including clients more in goal setting, or considering more so how those goals are going to be improving the quality of life of the client. Participants said that the training could be improved by encouraging music therapists or aspiring neurologic music therapists to examine their own biases and how that might contribute to the ways in which they're setting goals and the way that they're viewing their relationship with the client. And more of this discussion about goal setting. This was something else that, came up often and was really prevalent in the interviews, was how and why are therapists setting the goals that they set? The implications for these findings were that neurologic music therapists may reduce the potential of harm to clients by examining biases. Clients should be centered in goal setting. And some changes that the Academy of Neurologic Music Therapy could make to its training to improve the training could be considering extending the training, examining the ableism that is inherent in neurologic music therapy and the way that the training certification program is presented. And also maintaining a more open-minded attitude towards other forms of music therapy, because none of the participants considered themselves to be exclusively neurologic music therapy practitioners. They all considered themselves to be eclectic, and neurologic music therapy is one tool that they use within their clinical practice. And so considering this, the Academy of NMT could improve the training by remembering that people aren't going to be going out into the world and only doing NMT. And when they position neurologic music therapy as being superior over other forms of music therapy, which people are also practicing, that could potentially dissuade people from doing the training or from, recertifying. Some limitations of the study were that there was only a small number of participants. There were 5 people. They represented a limited range of identities. All of the participants were white, cisgender women who live and work in the United States. So not a extremely wide range of viewpoints. So suggestions for future research could be repeating this research with a larger number of participants. If possible, encouraging a wider range of identities, a wider range of, how people identify included in the study. I think it would also be really beneficial for this research to be repeated with neurologic music therapists who may be disabled themselves or maybe neurodivergent themselves, to see how they might have a unique perspective on how NMT does or does not center disability. Here are my references. And now I will open up for questions.
Okay, thank you for your presentation. Well done. I'm going to allow Vern to make some comments and ask some questions first, then I will continue after.
Congratulations, first off, yay.
Thank you.
Got this far, so exciting. Really interesting study. Sorry, I have 2 screens, so I'm not just looking off into space. I feel like we kind of missed learning about how you recruited for the study and how did you choose your participants?
Yes. So I recruited participants through sending emails to people who I selected from the directory on the Academy of Neurologic Music Therapy website. So finding those people who are NMT certified, and also through word of mouth and through like Facebook pages for NMTs. The people who did end up participating, most of it was through word of mouth, people who I know through the program and people that they know through their workplaces. So those are the participants that did end up reaching out to participate in the study.
Okay. So I guess when I was reading it and kind of listening to the presentation, I was thinking about some of the word choices.
Okay.
And I hate all this because sometimes it feels so like minutia, but so thinking about like in the beginning of the paper, you use the term critical, and it prepared me to think that this was a critical inquiry, and you never really said that in this, and then you never kind of said it in the written form either, that this was like a critical study. So I agree with that. Like I tend to think maybe this has critiques in it, but is not a critical inquiry, if that makes sense. So, and I think those things can be differentiated. So I would suggest maybe when you use the word critical, I would just wonder if maybe there's like another term you could use there. Maybe like, maybe even critique would be more appropriate. I don't know, but you can kind of decide that, but, and so
appropriate.
Yeah. And then I think the use of the word qualitative is a it's just kind of like an umbrella term, right? And so it could sort of mean
Right.
anything. And so I was wondering if we were to kind of zero in and think more about like the methodology and
Mhm.
your how you're analyzing the data. You know, is there something more specific, like a term that we could use that might um, better like describe what you're doing? Because I think what you did is great, you know, but it's like how do we describe it, and kind of it helps us to like situate it among other research that's out there, right?
Right.
So rather than
Yeah,
just
I was thinking of it kind
qualitative.
of like, yeah, I was kind of
So
thinking of it as like more of like a descriptive study, maybe describing, how neurologic music therapists currently view, an issue,
mhm.
perhaps.
Yeah, so yeah, there's like descriptive, and I mean, are you familiar with like thematic analysis? That this might kind of fall under that too, like your
Mhm.
like themes emerging from the data,
Okay.
you know, that kind of stuff. So
Mhm.
you might consider kind of framing it in that way. Maybe
Like
that'd
that,
be
yeah.
helpful.
Yeah, definitely. Thank you.
Um, and then something that I just kind of noticed, in my opinion, it would make it stronger if you talked about. And I don't know if you did this or not, and if not, it's
Uh-huh.
okay. Just like disclose it. Would be looking at like research standards. So things like member checking. Like, you know, did you go back and did you say like, did you talk to the people that you interviewed? You know, does this seem right to you? Does this feel like what you were trying to say? So there's member checking, there's triangulation, there's something called prolonged engagement with the data. You know, so what are those things that you did to make sure that um, that this study has that trustworthy element to it, right? So I would encourage you, maybe, you know, it's just like a paragraph, right? You know, just add something in about that. Um, and yeah, and then just as far as, you know, gosh, I hate saying these kinds of things because it's so picky, but like the beginning of paragraphs indent, make sure you indent beginning of paragraph. The only one that isn't there's two exceptions. One is the abstract, you don't indent, and if you're doing block quotes, you don't have to
Mhm.
indent those, but the other parts. So just a little APA 7 for you. But I'm curious, what do you feel like surprised you in the data? Like when you did the study, what do you feel like you didn't know when you started the study that you learned about?
Um, I think a lot of it didn't surprise me. A lot of it I was like, yeah, that makes sense. That's kind of something that I noticed or something that I thought about it. But one thing that I would say stood out to me maybe as something that I hadn't thought as much about was maybe including relationship building in the training, or a
Mm,
discussion of relationship building in the training, which I thought was an interesting idea to really center the client, because that was something that was talked about a lot in the interviews, um, and something that was considered by a lot of the participants, but the idea of how to make that happen, through talking about adding relationship building as a element of the NMT training itself, I thought was a
hmm
really interesting idea.
hmm hmm Um, great.
I I would say, sorry, thank you, Vern. I would say that
Yeah, yeah.
if that was something that surprised you, that in somewhere in the discussion you could say something
Mm-hmm.
along the lines of, or somewhere, that many of these things um, were things that you sort of expected in the
Mm-hmm.
data. but that was something that did come up as being pretty significant to you. I wouldn't use the word significant, but that was a finding that seemed important. And given a couple of the things what Vern has said so far is that somewhere in your methodology section, if you can have a trustworthiness paragraph where you talk about, because you did talk a bit about how you sent the transcripts back to them and that you read them over several times and that you did these things. If you use those terms, member checking, prolonged engagement, another trustworthiness thing is using the actual words of the participants to support what you're talking about, to show that these are examples from their own words. All of those things add to the trustworthiness. Sometimes spending a lot of time with a research team or your advisor to discuss those things. That's not something that you necessarily did, so you wouldn't put that in, but that would be another one of those things that would go in the trustworthiness section. I wanted to go to your limit, because a lot of the things that I had down, Vern already talked about. One thing, I have a few things. One thing that I wanted to, as you were talking today, I was thinking, NMT is NMT.
Right.
It's not trying to be holistic, right? It's not trying to be anything else. And so it may be that some people are actually going to an NMT person precisely because they want an expert and they want something fixed, right? So that could actually be the reason it is happening, even if we do understand that some of these things are ableist. And I was thinking to myself, this year I've gone through this whole experience of being diagnosed with cancer and going through treatments. I don't want to go to somebody who's not an expert, and I don't want to go to somebody who's not going to fix that problem. And so there are times in which those things are quite appropriate. There are other times when I might go to a psychotherapist and I don't want a cancer surgeon, right? I want something else. And so I think that it might be important to sort of bring that out a little bit, or to say in the limitations section, you talked about lack of diversity, which is important, and you talked about small number. That's less important because of the kind of study that it is. But you may want to think about limitations in terms of some of the questions that Vern asked you, actually, which is a limitation the way I asked the questions? Did that lead people to respond in a very specific way for things that I wanted them to say because that's already what I felt about it? So were the questions leading to these responses, right? Or are my own beliefs and values about NMT shaping both how I ask the questions and how I analyze the responses? Like, how much of that is in it? And are the participants who I actually got, because you ended up getting people from the program or people they knew, are they actually representative of the larger NMT?
Right.
Or is it the handful of people who, like you, are questioning some of these things based on their own philosophies, which may in fact have brought them to this program in the first place, right? So did the people that you get, are they really representative of the larger NMT group or not? So I would put those kinds of things in for your limitations rather than the number, which is not necessarily a limitation, but certainly the lack of diversity. But it might also be the lack of diversity of values and beliefs, right? And you may have ended up with people who who support, I mean, we do that a lot in these days anyway, through the kinds of people that we interact with on social media, or where we like go to different places. We tend to find people around us who support the ways in which we understand things. So it may be that the people that you actually ended up with do have these views, but maybe the majority don't.
Right.
So those would be little revisions that I think.
Yeah, that makes sense.
Did you have something you wanted to add? Did you open your mouth?
Yeah, I'm just it got me thinking, because it got me thinking, like, it'd be really interesting to go back and do, like, to survey all of them and like do a quantitative study, and like, who believes this, who feels the, like, do you identify with these ways, like, it'd be interesting to kind of go back and
rating scale.
Yeah, right, exactly, and try and get a picture, and certainly not as part of this, but like as another study, like, I think that might be kind of an interesting place to go with it. Like, it seems like you're identifying that there are at least some part of the population believes these things. So, like Sue's saying, like, how many people, like, where does that segment of the field fall in, in terms of like how they think about it.
Yeah. And like where they rate the importance of those things.
Exactly. And I guess, we're talking about ability, but I'm wondering about, are there other problematic things in this training? Probably, like, we're humans.
Yeah,
and,
perfect.
And so, it'd be interesting to look at things just beyond ability, that are happening in there, and why.
Yeah. And I think a little of that was touched on by some of the participants in terms of the length of the training and more things like that related to the training itself rather than the content. But yeah.
Mm-hmm.
Are you thinking, Vern, about like culture or
Right. Gender, race, right?
Oh yeah.
Yeah, definitely. Like, let's say you're to do like 2 studies, right? Or like you do that quantitative study, find out how many, for example, Black music therapists do that study or do that training, and then is it disproportionate to the field? Why? I don't know if that's the case or whatever, but it would just, like, be kind of interesting to kind of look at something like that. I don't know. That's just kind of where my mind goes with it. But the other thing I wanted to bring up too was, and I need to ask Sue and kind of ask you at the same time, like, thesis, like for a qualitative study, we wouldn't use like a thesis statement. Is that correct, Sue? Because I feel like you kind of get either it's a thesis statement or something really, really close to a thesis statement, the beginning of your methods, I want to say. And I when it's a qualitative study, I tend to think more about like a sense of discovery rather than coming in with like an idea of what you might find, right? I feel like you made a statement in there about like, I think this is what's going to happen, but that would be more quantitative. We might use that kind of language and kind of direction, but so I don't know, maybe just something else to look at. But thank you, good job.
Amanda and I are both at this moment thinking it's just great to be at this point.
Yeah, for sure.
So I want to congratulate you for getting it all done and finishing up and getting married and all these other things in the meantime. And yes, we will chat with, Vern and I may need to set up a time to chat with Katie just to like get all of her feedback as well.
Right.
And back to you on that. And it's probably easier for the 3 of us given that we have daytime. Well, we have some daytime stuff available and we're all at the same university. So that should be pretty easy to set up once she's able to have talk. But we will get back to you as soon as possible. We'll get in, we'll give you a set of things to revise.
Okay.
Usually because it's the end of semester, I'll probably put in a grade change anyway, and then have you do the revisions so that you can then submit it to the library. So we won't make you do them all within the next week or anything like that, because that will give you a chance to sort of think about, okay, how can I incorporate this feedback? And I think putting some of that stuff in the limitations is, good enough.
Yeah, those are good ideas.
Yeah, and then making some changes to what you're calling. I think thematic analysis is a good idea rather than a very generic qualitative umbrella term.
Yeah, and I think I used in the thesis itself, I think I used qualitative descriptive, but thematic analysis is probably a more accurate representation.
Yeah. And then if at some point you, like, maybe in the discussion, you just sort of maybe complicate a little bit some of the statements about, I mean, I personally, just because of my values, agree with not wanting to reduce people to like the things that are wrong that need to be fixed. But there are some people, and I do also believe this, I'm a parent, who will think, well, if I can fix this, then my child will have more freedom to do these other things. And so I don't like to think very one way or the other. I like to think, okay, well, let's complicate it. Yes, there are ways in which they're fixing, and that's why I think this idea of the relationship building thing is really important, and understanding the whole person. And at times it won't always be able to be possible, but when one can have the person involved in part of that goal, is this something that you want changed? These are some of the things that might be available to you if you are able to master this thing. I know that one of the people we had come in and talk to students who does sometimes do some of the training, Suzanne Oliver, she did talk about, looking at some more of the emotional domain in some of the work. And she does also say that sometimes it helps free people up to be able to master certain things physically, and that then they're able to do all these other things that we might want them, that they can then express themselves through music once they're able to actually do something different physically. So it does. So I think having some kind of reflection on it's not all good or bad, right?
Right, absolutely.
On white thinking, but what is it about fixing that can sometimes actually be emancipatory rather than always being seen as a terrible thing?
Yeah, definitely. And I feel like I got the impression from a lot of the interviews, maybe that it wasn't necessarily, like the fixing itself that was a bad thing, but or not a bad thing, but like something that could be improved. But maybe just the general attitude that people approach it with. So then again, going back to that relationship building, that could be a way to talk about, how, while you are trying to fix something about a person, you're also considering all of those other elements as well.
Yeah. And so going back to my example of the things I've been going through, being around medical, so gender-wise, at the moment, my entire team are women, right? And it's been fantastic because my experience with male doctors has not been great in the way that they assume things about what I know or think or feel or whatever. And so I think that there's something about having women doctors that has been really phenomenal for me. And at the moment, we were just commenting on it the other day. I think it's because we're living in Atlanta, but every medical or therapy person that my husband sees are almost everyone is a Black woman, right? And again, the care that he's experiencing from that is phenomenally fantastic. And so I think sometimes sort of thinking through, okay, what is it? And you touched on that when you were talking about getting, you know, neurodivergent therapists who do NMT to weigh in on what this might be like, you know, coming from that perspective. Working with people would be a really another interesting further, like if you talked about further research, that'd be an interesting one, going into a quantitative study to find out how many people actually think this. That would be another interesting further research. So
yeah, definitely a lot of interesting different directions that, you know, could branch off.
Yeah, and if you put them down, then someone else is going to pick them up and do it if you don't.
Yeah.
All right. Well, you can celebrate tonight in whatever form you want to do that, and we will get back in touch with you.
All right. Thank you so much.
All right.
Congrats.